From Cockerell Dermatopathology, here's Dr. Clay Cockerell.
Hello, I'm Dr. Clay Cockerell, a dermatologist and dermatopathologist here at Cockerell Dermatopathology, and I'm here to talk to you today about one thing that happens not infrequently, and that is what we refer to as getting requests for margins on biopsies. Margins are commonly, in fact routinely reported when a clinician does an excision. For example, a basal cell carcinoma that may be sent to a Mohs surgeon or done in an elliptical fashion. There we automatically report margins because you want to know if the lesion has been completely removed or not. Sometimes we get margin requests for shave biopsies, and sometimes those can be valuable. In other words, if you think you have a small basal cell carcinoma, you've done a shave biopsy of the lesion, you ask for margin, and we can tell you it does not seem to be left in the specimen. It doesn't extend to either of the edges or the base. And that often is enough, and you can follow the patient. If it doesn't come back, no additional surgery is necessarily required. However, sometimes we get margin requests on things such as malignant melanoma on a shave biopsy. And those are virtually never adequate for complete removal. The melanoma cells can track down a hair follicle. They sometimes may not seem to be present at the edge of the specimen, but they can still be deeper into the block. So we can only give you an approximation as to whether or not that really and truly is adequate therapy. And for malignant melanoma, I would strongly recommend against using that margin report for treating the patient. We also sometimes get margins for lesions that are benign, like for example a seborrheic keratosis or maybe even a wart. Sometimes even an inflammatory disease. We sometimes get margin requests for things such as psoriasis or for nail clippings, things of that nature, even alopecias. This may be because the nurse or the medical assistant is checking off the margin request automatically. Clearly, most dermatologists or even other physicians that perform dermatology work are not really truly interested in whether psoriasis extends to a margin, for example. But nevertheless, we still report that. And sometimes we even get calls from office staff saying that they didn't report the margin on an inflammatory skin disease. So if you really want these and they're meaningful to you, we're more than happy to report those. But in some cases, it does lead to more time and energy on your office staff receiving phone calls and other things for things that really may not mean very much to you. So I would just ask that if you really are truly interested in a margin request, make sure that you understand that it is being requested. Some cases you may not even know that it's being requested, and understand the limitation of a margin request on a biopsy versus a margin request on an excision. We're always here to try to do the best we can to serve you and your patients and create the best experience for your office staff and for you. Thank you very much for listening.
To learn more about joining the Cockerell Dermatopathology family, visit dermpath.com or contact us at 800-309-0000.